My name is Jada Veasey, and for the past school year, I've had the honor and privilege of serving as the Resolutions Committee Chair for the Mount Mercy University Association of Nursing Students, also known as MUONs. Every year, this year included, we write what we call resolutions. So what is a resolution? Every year we gather a team or two of writers. This year it was two separate teams to create resolutions, which are pieces of policy that are based in nursing and medical literature. So essentially, it's something that we want to see implemented in the world of healthcare. And we write these resolutions, these pieces of policy, and then we go and present them at two conferences each year. In the fall, in October, we present at the Iowa Association of Nursing Students annual conference. And then in the spring, in April, we present at the National Student Nurses Association conference. And we try to get these resolutions passed in the House of Delegates in both the state and national levels. So this year we ended up writing three resolutions. You may have already noticed that resolutions 2 and 3 look kind of similar, and I will get to that when I talk about them. But I'm going to start with resolution 1. This resolution was written by me, Jada Veasey, as well as Aubrey Driscoll, Jessica Peterson, Madison Swartzenschuber, and Yvette Yadira Mendoza. So resolution number 1 is titled In Support of Mandatory HPV Vaccines for Students Attending Universities in the United States. And the abstract reads, HPV is the most common sexually transmitted infection. Nurses have a responsibility to advocate for the administration of HPV vaccines, especially for high-risk populations like college-age students in the United States. Supporting mandatory HPV vaccines for university students will improve health outcomes for the age group. We were able to get this resolution passed on the state level. Resolutions 2 and 3 were written by the same team of authors, including me, and then Jessica Irving and Megan Alsup. So resolution 2 is in support of increased telehealth education in pre-licensure nursing students. And the abstract is that in the modern world, telehealth is being used in the healthcare setting more often than ever. It is important for nurses to be competent and confident in their use of telehealth techniques and technologies. In order to promote confidence and competency with telehealth, pre-licensure nursing students should have exposure to telehealth in their nursing educations. We were also able to pass resolution number 2 on the state level. We passed resolution number 2 with a much stronger margin in the House of Delegates at the state level. So when we were debating whether we were going to take our first or a second resolution to the national level, we ended up going with resolution number 2 just because we had a lot more support on the state level. Every university is only granted permission to take one resolution to the national level, so we had to decide between the two of them. So when we initially submitted our second resolution regarding telehealth education and pre-licensure nursing students, the national organization got back to us and let us know that in the past 5 years, similar policy had been passed by the National House of Delegates. So essentially they told us that it was an ineligible resolution, but we really fought hard and we asked for permission to make revisions so we could submit an altered resolution just so we would still be able to participate in the National House of Delegates, and so we would be able to pass policy. So after finding some new sources and learning some new things, we came up with our third resolution in support of increased awareness of telehealth as a method of primary care in rural areas. The abstract reads, in the modern world, telehealth is being used in the healthcare setting more often than ever before. It is important that healthcare professionals and healthcare organizations recognize how helpful telehealth can be for those residing in rural areas with limited access to in-person healthcare options. So taking our resolution number 2 and altering it was certainly an educational experience. We were really torn on what direction to go in with telehealth after we found out that there had already been policy passed regarding pre-licensure education, but we really thought about it for a while and realized that being nursing students from Iowa, advocating for the rural population's health and health prevention, really made sense for us since the location we're in and the patients we'll be serving once we are nurses and we have our licenses. So it just made a lot of sense. And luckily we were able to pass our third resolution, our revised telehealth resolution on the national level with a pretty decent margin in the National House of Delegates. So we're very proud to have been able to pass a resolution, and we're so happy we are getting to learn about nursing policy and participate. And it's been such a fun and educational experience. So I just want to thank my fellow authors who I mentioned with their respective resolutions, and they're also listed on the poster. And I also wanted to say thank you to MUON's president, Marshall Muehlbauer, who has been instrumental in the process of getting everything off to nationals. And I'd also like to thank a few of our professors, Jody Reed and Audrey Scheller, as well as Dr. Sharon Guthrie for all of their support and all of their knowledge throughout this process.